Hi, thanks for tuning in to Marshashana Yoga. Recently we did an episode on cancer, and at that time I mentioned that this was a most feared disease, but not the biggest killer. That title would go to heart disease, and that holds true for men and women. Although men may be symptomatic earlier, women suffer more heart attacks. 1 million Americans each year die from heart disease. That accounts for 1 in 3 deaths. And during a heart attack, part of the heart muscle expires. So if you do survive the incident, scarring from this could lead to other problems. There are different things that can happen with the heart. Blood vessels can be narrow or blocked. Heartbeat could be irregular. Some people are born with a congenital defect. Our friend Tucker, who is 5 days older than Mark and has Down syndrome, had to have major surgery at just a few days old to treat this. The heart muscle can be weak. Sometimes infection can cause problems, and there might be issues with the valves. Symptoms can range from chest pain, angina, and pain in other areas of the body, including the jaw, upper abdomen, the back, places you might not typically think of as related to the heart. Also, shortness of breath, dizziness, swelling in the feet or ankles, pale skin, persistent cough, and skin rashes. There's some fascinating new research in the Journal of the American College of Cardiology that found 6 factors for heart attacks. They're pretty familiar to us: diet, exercise, smoking, alcohol, being sedentary, and percentage of body fat. What is really cool is that this study and another 2014 study with men showed that 80% of heart attacks in men could be prevented. Astounding. In 2014, there was some amazing information put forth by Thomas S. Cohen, MD. He gives good evidence to support the idea that rather than a heart attacks being caused by blockages, which he says will be accommodated for in the body naturally by simply making alternative routes, and that in most cases, blood flow is not the cause of a heart attack, that they are caused rather by dysfunction between the parasympathetic and sympathetic nervous systems. According to Dr. Cohen, when there is chronic stress, there is less healing going on in the body. When under great stress, the sympathetic nervous system is stimulated, and this causes the body to be in a state of fight or flight most of the time. This over-the-top release of adrenaline causes breakdown of the cells in the heart, which means it cannot get proper fuel, and in turn it does not contract properly. Stress also increases inflammation in the heart. This inflammation seems to occur more in those with what we commonly call type A personality, or what those in Ayurvedic medicine call pitta. These people are high achievers, intense. Their fire burns too hot. So we need to bring our stress levels under control. Yoga really helps with this. How? Well, it has been proven to reduce stress, and stress hormones are what raises heart rate and blood pressure. Yoga's ability to teach calmness and thereby lessen anger can also help to bring strong emotions under control. Statistics show that many heart attacks happen within 3 hours of a person having an episode of intense anger. Yoga helps to raise our awareness so that we can observe when we are getting very upset and perhaps study that. A study dating back to 1948 described in Minnesota Medicine showed that heart attack patients were able to discontinue use of nitroglycerin and other medications after doing a regular program of alternate nostril breathing. More recently, Dr. Dean Ornish's studies followed a group of patients who adhered to a comprehensive program, including asana, the postures, pranayama, breathwork, and meditation. And as a result, were able to lower their cholesterol levels a lot, had a 91% reduction in the frequency of angina, and also had fewer heart attacks. This trial also showed that patients were able to reverse years of damage to the heart muscle. Again, astounding. For those who have already suffered a heart attack, the yoga can help with the emotions that come with the need for surgery and aftercare. In addition, many individuals have been able to come off blood pressure medicines too, through the practice of yoga. This regular practice can also lead to weight loss and even lower blood sugar levels. It increases lung capacity and blood circulation, reduces inflammation in the body, and builds muscles. Further, it can help people become more conscious of what they are putting into their bodies. After a heart attack, a major problem can be depression. Yoga helps to balance the chemicals in the brain and has also been shown to help people see a more positive path in front of them. I think, as with anything, the more you put into your yoga, the more you get out of it. This is true for myself as a teacher as well. Long-term regular yoga can increase good health by lowering cholesterol levels and blood pressure. At least 37 clinical trials have determined this. I have reduced my own cholesterol levels through yoga and some adjustment of diet. Research has shown an average of 5 points off the cholesterol reading. It also means that those who have physical limitations can benefit greatly without being out there ripping up the gym or pounding the pavement. So with that in mind, we'll do a workout now geared toward those who have heart conditions. You're all welcome to join in. We're going to modify some of the positions. And remember, as always, nothing should hurt when doing yoga. Any position that causes you any pain, you should move out of it and into a restful position or into the prior position and just wait. Whenever you feel tired, just move into a restful place. So now we will move to the mat. We begin today by drawing our attention to our breath. We notice the heart center, the rise and the fall of the breath. We allow our concerns to drift away. As they come to our mind, we just allow them to pass by, returning always to the breath. Today I'm using an eye bag, which you can also use to help you just keep your eyes closed and concentrate on your calmness and your breath. We allow the heart, the mind, the spirit to open. We know that yoga has many benefits, but one of them for sure is bringing calmness to people. So we inhale, allowing the chest to lift and rise. We exhale, allowing the back body to relax. We know that chronic stress, emotional stress, can worsen symptoms such as blood pressure, the hardening of the arteries, can cause irregular rhythms in the heart. So we need to be calm. Staying with your breath, draw your hands one to each elbow and just allow the arms to rest either on the forehead if you have a shoulder issue or on the bolster, and just opening the chest up. Taking a deep breath into the center of the chest. And another breath. And releasing the arms. Let the arms come down, release the legs from the blocks, extend the legs. Begin to point and flex the feet. So we're pointing, stretching across the top. We're keeping well grounded in the legs. We're drawing the toes back towards the face. Then pushing the toes forward and then bringing them back. And then bringing the feet to center, just widen them just a little and make some large, slow circles with the feet. We begin to warm up all the extremities, preparing for the asanas. And then in the other direction, and just making those nice wide circles. In coming to center, we bring the big toes together and just point them forward, allowing for a slightly different stretch. And then coming back up, we windshield wiper those. Again, we notice the movement from the ankles all the way up to the hips. Coming back to center, extend the legs in front of you at hip distance, extend the arms behind you, reach and lengthen through the sides of the waist. Inhale, exhale. Inhaling, lowering the arms with the exhalation. Bring the feet to the floor one at a time. Allow the head and the knees to rock left as you inhale. Right as you come over. Exhale. Inhale left. Exhaling right. Inhale left. Just massaging the head and the lower back, and to the right, exhaling. Coming back up to center. Extend the left leg and the left arm, reaching through that side of your body. Inhaling, exhaling, the leg comes down, arm comes down, leg comes back. Extend the right arm, right leg, reaching through that side. Exhaling, bringing the knee back up and the arm down by the side. Extend the arms again, extend the legs. And just elongating the spine, always going for that release of energy from the spine. Always breathing. Inhaling, exhaling down. And I'll just ask that you bring your feet to the floor and just raise yourself up and bring a block to the bottom of your bolster. And we're going to just bring ourselves up on the bolster. The buttocks come up on the bolster. Come back down. Extend the arms, extend the legs. Exhaling the arms down. Bring the feet back one at a time to the floor. And bring one knee into the chest and then the other. We'll just rock that gently. Bring the feet back one at a time. Make sure that you feel safe and secure on your block. You may have to adjust a little. Cross your left leg over the right. Allow this thigh to open. And then bring that hand to that knee and the right to the right knee. Draw this up for a moment. Just hold it there for a moment, getting a stretch to the left hip. Extend that right leg up. Point and flex. Make sure your chin stays level. Not jutting up. You may need another pillow. Just pushing that heel up towards the ceiling as the fingers hold the back of the thigh. And then fold that down and bring the interlaced fingers in front of that knee and just pull that in a little bit if you're able. If it compresses the chest area, do not do this. If you can do it with leaving the chest wide, that's fine. Take the right leg down, uncross that. Draw that left knee into your chest. And then just extend that up. And point and flex the foot. Arms are long, leg is long. Stretching the hamstrings. Draw that leg down. Bring the other right knee into the chest for a moment. And then extend that up, interlacing those fingers and pushing that thigh into the fingers as you drive the sole of the foot towards the ceiling. Point and flex. And then we'll take that leg down, cross it over. We're going to open up that thigh area a little bit and bring the hands up. And just holding that in for a stretch of that right hip flexor. Extend the left leg up, interlace the hands behind and point and flex that foot. Nice stretch for the hamstring. And then bring that knee down and interlace the hands in front of it. Again, if your ability allows for this. Bring that left foot to the floor, the right foot to the floor. Extend again the arms and the legs. Reaching through the fingertips and through the heels and extending the arms down by the side. Bring the feet back to the floor one at a time and just gently sway the hips back and forth. Noticing the feeling on the lower spine. And then we'll come back up to center and we'll just lift up, remove the block, come up to seated as you move your bolster and pillow to the side and out of the way. And then we'll come back down to a flat back position. And here we'll extend the arms, the thumbs are leading, we reach behind us as we reach to the heels. So just lengthening and extending our bodies. Exhaling the arms down by the side. Bring the feet to the floor one at a time and draw those knees into the chest. And just gently rock them. Leave a little distance between the feet and the legs as we gently rock them. And then we move them a little side to side. And then bring them a little wider apart, open the knees a little, take your fingers close together, bring them to the knee crease and draw the thighs to the chest as you push those soles up towards the ceiling. We're going to point and flex the feet here, and then bringing those soles up. Take a breath, breathe. It's very important for those with the heart condition to keep breathing. Do not hold your breath. It's important anyway in yoga, but particularly important for those with a heart condition. So keep breathing. And then bring the soles of the feet together as we point those up at the ceiling. And then drop the feet to the floor one at a time and extend the arms, extend the legs again. Exhale the arms down in time with your breath. And then bring your arms up. So we're going to bring them up straight. You want to be able to make sure that you can see your hands in front of you. They should not be back behind your shoulders. That's not good. So bringing the palms facing each other, we make a loose fist. And we spread the fingers wide. And then make a loose fist and spread them wide. And once more, keeping the arms long. Take them to a slightly wider V. Place the palms facing away from you and begin to grasp at the air using the arms and the hands and the fingers, just really using all of these parts of the body in an invigorating manner. Breathing, of course, and then bringing the arms a slightly bigger V. Bring your forefingers close together and bring those fingertips to the palm pads, and again involving both the arms and the fingers. The arms and hands are extensions of the heart. So as we do this, we not only bring circulation to the arms, but we bring good stuff, good energy from the heart up the long channels of the arms. So love, forgiveness, compassion, empathy, shaking the arms down. Noticing for a moment the feeling of the arms, just relaxing the body. Bring the attention to heart center. Notice your heart beating and the rise and the fall of your chest. We always attempt a mind-body connection so that we keep the breath in the mind and the spirit with the movement of the body. Extend the arms, extend the legs. Exhaling down. And just roll over now and come up to your side. And we'll come up to a standing position. So we'll remove the blanket. And we'll come to the front of our mats. You should bring your blocks, depending where your own practice is at, and everyone has an individual program for themselves. We come into Tadasana. Feet are even and parallel. Inhale, lift the toes, spread them. Exhale, place them down. Little balance work, bringing the arms up halfway, not above the shoulder, and lifting up onto the toes. Just strengthening the toes, ankles, coming all the way up to the hips, and then bringing the arms, if you're able, overhead, extended tall mountain, releasing down. Inhale. Exhale. We will do chair pose now. The difference with those who have had heart conditions is that we're not going to raise the arms as we normally do vertical. If you're working with us today and you're able, that's fine to keep those arms up. But for those with a heart condition, we will either keep them all the way down or at a low stance. So keeping them down, we move into that position where we're bringing ourselves in a seated position, bringing the thighs as close to possible as parallel to the floor. Bring the hands behind, interlace, lift the arms up. And then coming back down. Inhale. Now, one thing with people with heart condition is they don't want to hold the standing poses too long. You want them to be brief. So we'll be doing that. You'll notice us moving in and out of the poses quicker. Again, inhaling overhead. Exhaling down. Bring the hands to the hips. We'll step back with the right foot angled out slightly as we prepare to move to Warrior One. We bring the torso towards where we're facing, but never at the expense of other things. So it may take you a while to get that torso to move, so be patient. Again, with Warrior One, we're going to hold the hands at the hips. We're not going to bring them up above the head with the heart conditions. We're going to inhale, exhale, bend that forward knee, making sure that it comes to a place right over the ankle. The back foot is well grounded. Try to ground down on the outside of that heel. And then bring that knee straight. Inhale, exhale, bend the forward knee. Inhale, straighten knee, exhale, bend. Inhale, exhale. And then coming up and just stepping forward with that foot. We come back into that original position, hands on hips. We step back with the left foot, angled out slightly. And we move that torso towards the front. We ground down with both feet. Inhale, exhale, bend the forward knee. Come into that 90 degree. Thigh is parallel to the floor. Straighten the front knee. Inhale, exhale, bend. Inhale up, exhale down. Inhale, and exhale. And just stepping forward. Inhale the arms overhead. Exhale down. And we'll now move towards the front of the mat as we bring the chair. We're going to bring a folding chair. So we start on one side. We're going to just bring ourselves by the chair. We're going to bring the right foot up on the chair. Or the left, depending where you're situated, doesn't really matter. We're going to use this to balance so that we have that. But we're going to bring the knee to the leg to this position so that we straighten, we stretch the hamstring. Then we're going to move back in 90 degrees, always to protect the knee. It can come here, but not over. So we just move in and out of that to stretch that hamstring. Make sure you point the toes right up to get the stretch. You should feel that. And then again, coming back, stretching that hamstring. And then backward. And then we'll just move the chair and we'll just do the other side. So we're just going to come down, bring that other leg up, because we like to have the place where we can balance if we have to. And then bringing this back here. People who have undergone the heart situation may be a little bit weak. They may be a little, maybe a little harder for them to do these things. So we want to make sure that we have a place to balance if we need to. Just stretching that hamstring out. Make sure as you bring it back, you bring the toes straight up. You'll feel it, and then coming back. And then we're going to come off the chair. We're going to leave the chair here, bring it to the edge of your mat. Come to the front. Step wide as we do for Warrior Two or Trikonasana. We're going to do both of those poses. We're going to turn that left foot out a little bit. We're going to turn the right toes in a little. Make sure that your hip, knee, and ankle are in a line. Bring your torso as much forward as you can. Extend through the arms. Reach through those extremities. And then bend that forward knee to that 90-degree angle in Warrior Two as you look out over that hand, strong position. Come back out again. We're not holding these with these heart conditions. We're going to reach forward now with that arm. Bring it down to the chair. Bring the other one over in Trikonasana. And if your neck is healthy, you can look up towards your thumb. Come back up. Bring the feet to center. Bring the legs together, either jumping or walking, tapping. Inhale overhead. Exhaling down. Just good to keep that breath going with the motion. Let's move it over here and move to the other side. We step wide. Feet is just a little bit under the chair there, just a little. Turning that leg out, checking to make sure it's straight. Back toes come in. Torso moves forward. Extend. Bend the forward knee. Exhale. Come into that Warrior Two. Keep the back leg grounded, strong. Front leg is parallel to the floor. Come up. Don't stop breathing. Bring the hands to hips. Extend again. Reach forward. Bring the arm down and the other one aside as you look up towards your thumb. Trikonasana, triangle. Come back up, not holding that pose. Coming forward. Tapping the legs. Inhale, round the shoulders. Exhale, tap. Bring the ears up to the shoulders to the ears. Exhale, ha. Ha. Now we're going to bring the seat to just facing forward. We're going to do a little work on the chair. So we sit not at the back of the chair, but towards the middle of the floor. We place our feet firmly grounded, hip distance apart on the floor. Take a breath. Bring the arms around inside your chair so that we open and lift the chest. Just allowing for that expansion of the heart. Bring them back to front. Inhale, take it left. Exhale, right. Inhale, left. Exhaling right, just working that neck gently. Bringing to center. Inhale up, not too far. You don't want to squish those vertebrae, but just a little. And exhaling, dropping the chin. Come back to center. Take your right hand to the left knee. Extend the spine up. Bring the arm back into the middle of your chair as you move the torso into a twist position. Come back to center. Take the left hand to the right knee, extend the spine up, bring your hand to the back, move into that twist. Now remember, we talked about the anger issues with people with heart attacks. So in these twists, we allow emotions to just be squeezed out of us. Come back to center. Again, bring the right hand to the left knee, extend up. This time, bring your hand to the top of the chair. As we get a little more maneuverability with the chest, bringing that over. We don't want the head to go way over beyond the chest. We want to keep it relatively with it. Breathing to heart center. Coming back to center. Take the hand to the other knee, extend up, bring that arm to the back of the chair, and move into that twist. Getting rid of negative emotions. And then coming back to center. So we'll come up off the chair now. We're just going to move the chair this way as we come down on our knees. So we're just going to place our feet slightly under the chair. We're going to bring the hands to the corners of the chair as we move back into camel. And this pose is good for opening up the heart. And then we come back up. We're going to turn around now. We're going to, let's see, we're going to come back up for a minute. And as we come here, we're going to bring our hands to the chair. We're going to step back. We're holding the corners of the chair, and we're just stepping back into down dog. We're going to let the head hang for a moment. And then we're going to move one leg forward as we come into Anjanasana, into a runner's lunge. And the knee again is 90 degrees. Now the thing is, inversions are discouraged for those with heart conditions. In other words, inversions like shoulder stand, headstand, not good. Bring that right leg forward, step back with the other one. Nice stretch for the calf in the back. So we stay away, people with heart conditions stay away from that. Why? Because they feel that it's thought in yoga that the internal organs in an inverted position put pressure on the heart. So we stay away from that. Step forward, and we'll just move the chair off to the side a little bit. We're going to bring our bolster to the pillow, to the floor. Our bolster down to the floor. In here, we're going to come down to our knees. We're going to move into a cat-cow position. We're going to inhale as the head comes up to flat back. We're going to exhale. We're going to tuck and round up. Inhale forward. Round and tuck. Coming back to flat back, move your hands forward so that we're moving into down dog. We're all familiar with this pose, and we've got our hands placed firmly down. We're going to tuck the toes about the same distance as your hands are, which is about mat distance. And then we're just going to raise the back of the thighs up towards the ceiling and towards that back wall as we move into down dog. However, we are not going to stay here long with a heart condition. We're going to move into plank. Now, keeping your arms close into your side, lower yourself down. Now, let me say this. Let me start again. You can drop, I should have mentioned this, you can drop the back legs, the back knees. So you can come into it from this position. It depends on your ability. So we come into the plank. You can either drop the back knees or stay up and drop yourself. Knees, chest, chin, all come down at once. Bring those elbows in. Now bring your hands behind you. Interlace your hands. Lift. Push down with the pelvis. Lift up with the chest. Keep the neck long and straight. Don't let it come way back up. It should be in a straight line with the spine. Release. Come back. Come back up to child's pose, toes together, knees apart, rest the forehead on the bolster. So just resting. So there's yoga for everyone. And some of the restorative poses where we're actually, instead of you moving into the pose is moving to you by using modifications and such, can give us the ability for anyone to do yoga. So again, let's go back into that posture again and move those hands forward. Let's tuck the toes and come up once more up into down dog, stretching that spine and then moving into the plank pose. Once again, lowering down. Once again, interlacing the hands, push down. Lift, pull back with the arms, lift up the chest. Release the arms, come back to the knees, rest in child's pose. So another thing that's discouraged many times or not recommended is weightlifting type stuff that you do at the gym, weight training. However, we get a lot of that from the plank pose as well. And I remember asking my yoga teacher early on, well, don't I have to go to the gym to do this? But really, you are lifting your whole body weight. So you are doing weight-bearing work that's going to be acceptable for your heart and healthy for your heart. And remember, too, if you start small, you can always up it later as it goes along and things get better for you. Let's move that off to the side. So let's come right down to our stomach. For a moment, we're just going to cross the arms, rest the head for a moment, and breathe. And just noticing the sensation of your chest as it rests there. And then just moving the cross of the arms and moving the head to the other side. Breathe. And then coming up, bring the hands right to the sides of the ribs. And just notice as you draw down and back. Draw the shoulder blades down and back, pushing down with the palms of the hands and the pelvis and the tops of the feet and lifting up into cobra. Coming as far as you're able. Breathing, don't hold your breath. Bhujangasana, and then coming down. Bring yourself to child's pose. Rest the head. And we'll just roll over on our backs. So we'll do a little bit more stretching. So let's do that full body stretch again. Reaching through, exhaling down. We're going to do some more twist because that twisting action not only twists toxins from the body, but releases the negative emotions that can cause anger. So those are good to do. Let's bring our hands palm down. Let's bring them all the way out to a T this time so that we really open that chest area. Bring the legs to the chest, the knees to the chest. And then just as you inhale, as you exhale, drop the knees a little to the left. Keep the shoulder down, just go so far. Come back up. Let them go the other way. They're not together, they're a little distance apart, coming back. Bring them down to the floor. Hip distance. Press down with the small of your back and the feet. Let your legs go right. Let your head move a little to the left. Breathing, staying with us, staying involved. Inhale to center. Press down with the feet and the small of the back. Let the legs go left. Allow the head to move right. Keep that right shoulder down as much as you're able. Breathe. Inhale to center. Bring those legs a little wider apart, the distance of the mat. Make sure your body's nice and straight. And then pressing down again with the feet and the small of the back so you create that pelvic tilt. Let the legs go right. Let the head go left. Inhale to center. Pressing down with the feet, small of the back. Let the legs go left. Head moves right. Breathe. Inhale up to center. Bring the feet to hip distance. Draw the knees into the chest one at a time. Gently rock them. Bring the knees wider apart. Bring the arms through the middle of the legs. Grab the sides of the feet in Happy Baby. The soles of the feet are at the ceiling. We gently rock side to side. And we come back, draw the soles of the feet together, opening up that inner groin area a little. And then we release the legs down. Bring one knee in, pause. Drop that down, other one, draw it in. Drop that down, extend one more time. Exhaling down. And we'll come back up. We're going to put our blanket back down as we prepare for our meditation in Shavasana. So we come back down to the mat, to our blanket. I spoke to you originally during my discussion on the heart disease about the alternate nostril breathing. So we'll do a little bit of that. So we bring the bolster to the middle and we grab our blocks to support the knees as we always do. And just coming to that simple seated position, supporting the knees wherever you feel you need to. Bring the hands up. We're going to keep one hand on the leg. You can either keep it up or down, whatever you prefer. And we take the hand, we draw the 2 fingers in towards the palm pad. These other 2 stay extended as much as you're able, takes a little practice, and the thumb stays extended. We bring that up to the nose so that you don't have to rest it on the nose, but just above it, like cupping it almost. And then we block the right nostril with the thumb. Inhale left. Oh, let me back up a little. Drop the chin down a little and move it in just a little bit. Inhale left. Exhale left. Close the eyes. Inhale left. Bring open up the thumb side and just take those other 2 fingers, close the opposite side. Exhale right. Inhale right. Block with your thumb. Exhale left. Inhale left. Block with the fingers. Exhale right. Inhale right. Block with the thumb. Exhale left. Inhale left. Block. Exhale right. Inhale right. Block with the thumb. Exhale left. Bring both the hands, palms up on your knees, on your thighs. We'll do 1 Om, so we inhale to begin. Envision a beautiful golden light above the crown of the head. As we inhale, we draw the golden light in through the crown. As we exhale, we allow that golden light to flood the heart chakra, the heart center, allowing us to be open for love, empathy, forgiveness. Now we will gently move down to the mat, bringing the bolster under our legs and a pillow under our heads as we prepare for Shavasana. We are resting in this position, and while you rest there, I will read you something. So just allow your breath to come back to heart center. Bring it to heart center and notice the rise and the fall of your breath. Notice your heartbeat. We have talked a number of times on this show about opening up the heart. We move into poses such as Setu Bandha, a bridge pose that lift and open the chest. We attempt to create more space in this area and to also allow for more unconditional love, forgiveness, compassion. But what about when the heart is physically opened, as during surgery? The following is quoted from a post by Stephanie Livacari. In late December, my father had open heart surgery. The difference between these 2 ideas is obvious. One, a metaphorical concept, the other, a physical reality. But while they're very different, they can both be quite terrifying. An open heart is exposed, at the mercy of the elements, whether at the hands of the surgeon or at the mercy of the hardships and cruelties of daily living. We like to know that the heart is buried and protected beneath mounds of muscle and tissue and bone. We're happy piling on shirts, sweaters, and coats. But as we practice yoga, we begin to peel away these layers, or koshas, as they're known in yoga, one after another. And as the layers drop away, we become increasingly sensitive. A sensitive heart can feel and only by feeling can we become truly compassionate. Well, the result of my father's surgery is that they have installed a heart pump, a mechanical device that literally takes on the job of pumping blood through the body. The pump is internal, yet my father needs to be constantly connected to an external source of power, plugged into the wall at night and on rechargeable batteries during the day. This is indeed an amazing feat of medicine, and yet quite an unnerving idea. Imagine having to rely on something outside of yourself to live. What if the electricity goes out? But the reality is that we are all plugged in. We are all attached to certain things outside of ourselves from which we derive our power. We're plugged into other people, partners, family, friends, to our career, to financial success. Yet these things are tenuous. Money comes and goes. People come and go. Years come and go. So maybe we're all just as vulnerable as my father. Becoming aware of our vulnerabilities is ironically one of the strongest practices that yoga has to offer. Realizing that we don't have the control we think we do is a great step towards practicing deeper empathy for others and ourselves. We bow the busy, thinking mind to the more intuitive, intelligent wisdom of the heart. May the long-time sun shine upon you. All love surround you, and the pure light within you guide your way home. Namaste. Thank you.